This is the recommendation to be depression-free. The source is JAMA Network Open. The study was published in 2023, and the title was Depressive Symptoms and Mortality Among U.S. Adults. The impact factor of this journal is 13.8. A further description of the recommendation: a PHQ-9 was what was used to assess depression severity in the population. A score of 0 to 4 was no depression, 5 to 9 was mild depression, and then 10 or greater was moderate to severe depression. The findings are that individuals with mild depression had a 35% higher risk of mortality compared to people with no depression. Individuals with moderate to severe depression had a risk of 62% higher risk of mortality compared to those without depression. I have 8 recommendations for treating depression. The first one is lifestyle, and it's all of the things that are covered in other sections of this program: social connection, volunteering, sunlight exposure, physical activity, diet optimization, limiting alcohol and drugs, and then optimizing sleep. The remaining 7 recommendations are specific to treating depression, and I recommend that if you scored a 5 or greater on that PHQ-9. First, and I have them kind of in order of least to most invasive. First is journaling, and that's the way that journaling works is writing about feelings helps us recognize, name, and process the emotions we're experiencing instead of suppressing them. And fMRI studies show that labeling emotions in writing actually reduces activities in the amygdala, which is a key stress center. Journaling also helps us with identity and meaning making. Writing gives structure to our inner experiences and helps people understand who they are and what matters to them. How I personally incorporate journaling into my day is I write for 10 minutes each morning in a journal. How I personally incorporate journaling into my day is I keep a journal and write for 15 minutes each morning right after breakfast. Next is meditation. Meditation helps us refocus our attention. Often depression is associated with ruminating about the past or worrying about the future. Meditation, for example, breath meditation, helps us focus on the present. So our attention is no longer able to be focused on our negative emotions. And instead of suppressing negative emotions, what meditation does is it helps us notice them but not identify with them. It's like clouds passing through the sky. You see the cloud passing through the sky and you notice it, but you don't identify with it. How I incorporate meditation into my day is I do the Calm app for 10 minutes each morning, the daily Calm meditation. The next recommendation is therapy, and I should say that therapy, especially cognitive behavioral therapy, is one of the 2 best treatments for depression. The way that I recommend you proceed with finding a therapist is on the website psychologytoday.com. You'll be able to filter using your insurance to determine what would be covered in your network. If you don't have coverage for a therapist, I recommend going on the website betterhelp.com to find an online therapist where you pay out of pocket and you can use your FSA or HSA. One key strategy that I adopt, I'm in a new city and I had to look for a therapist, is to get started with a therapist, to not spend too much time trying to get the perfect therapist. Just get started with one, which was my plan. Instead of waiting to find the perfect person, I just started with one last week, didn't like him, so I'm going to switch to somebody else. But I find a lot of patients will get stuck trying to find the perfect therapist without actually starting therapy. And starting therapy is a great way of just auditioning therapists for the role. Next recommendation is bright light therapy. Bright light therapy has been shown to increase serotonin levels in the brain. The recommendation is a light box with 10,000 lux. You place it 16 to 24 inches from the face, and you use it within 30 to 60 minutes of waking up for 20 to 30 minutes a day. I use a light box when I'm having breakfast in the morning. Next recommendation is St. John's wort. The recommended dose is 300 milligrams 3 times a day. St. John's wort works by improving levels of serotonin, dopamine, and norepinephrine in the brain. These are all positive mood-inducing neurotransmitters, and lowers inflammation in the body. It also lowers cortisol levels. It's important to note that St. John's wort does induce cytochrome P450, which is an enzyme used in drug metabolism, which basically means that if you're on an antidepressant or oral contraceptive or HIV medication or other medications, it's going to reduce the levels of those medications. So it's important to talk to your doctor if you are on any other medication. It's also important not to use an antidepressant medication along with St. John's wort. So if you need an antidepressant medication, you should stop St. John's wort. The next recommendation is omega-3 supplementation. Depression is linked to chronic low-grade inflammation, and EPA especially has been shown to lower inflammation. You want to get a formulation that has at least 1,000 to 1,500 milligrams of EPA, and at least 60% of the composition of the supplement should be EPA as opposed to DHA. And finally, there's medication. Medication and cognitive behavioral therapy are the two most effective options for treating depression. Typically, we start with selective serotonin reuptake inhibitors like Lexapro or Prozac. These work by increasing serotonin and lowering inflammation, as well as lowering cortisol levels. Those are my tips for treating depression. Thank you.